Hey, you all know that the medical system in the US is one of the most expensive in the world and it's poorly ranked. Today I'm going to talk about Bernie Sanders' proposal Medicare for All. The biggest question I try to answer today is whether pharmaceutical and insurance companies are to blame for the high cost. Or maybe there is something else much more evil than that. Just a disclaimer, I live in a country with universal healthcare and I totally support it. And I used to live in the US and I know how inefficient and bad the system is. So, Bernie's proposals in short is to increase taxes for employees and employers and use this money to pay for the health system instead of current private insurance.
Under the Medicare for All bill that I wrote, premiums are gone, co-payments are gone, deductibles are gone, all out-of-pocket expenses are gone.
That's exactly how most of European country works and I totally support that. But will this reduce the cost? First, let's measure the headroom which America can potentially save on healthcare. We know that Germany spends 11% of GDP on healthcare, Switzerland 12%, and USA 17%, which is $10,000 per capita per year. It looks like 5% of GDP is being stolen from hardworking people by some evil medical system. And 5% of GDP is $973 billion. It looks enormous. To compare, Andrew Young's proposal of 10% what supposed to generate 800 billions according to his website. Apparently, you don't need any 10% VAT, you can just optimize the healthcare system. And apparently we can save $3,000 per capita per year. Now we need to understand who is stealing this money and let's see how the current medical system works. It starts with insurance company where you or your employer has to pay premiums every month. Then there is a pharmaceutical industry and sometimes insurance pays for your drugs or sometimes you have to do some copay. Then there is a doctor office and insurance usually pays for your treatments but sometimes you need to do some out-of-pocket expenses or certain copays. And then there is a doctor which receives salary. To become a doctor, you need to attend the medical school and you have to pay for it. Since you don't have any money, you have to get a loan from the bank. And when you're a doctor, you have to buy a malpractice insurance. So if you do something wrong and someone will go to the court, they will deal with this and you won't lose all your finance. According to Sanders, pharmaceutical and insurance companies are the roots of evil.
I will tell you what the issue is here. The issue is whether the Democratic Party has the guts to stand up to the healthcare industry, which made $100 billion in profit, whether we have the guts to stand up to the corrupt, price-fixing pharmaceutical industry, which is charging us the highest prices in the world for prescription drugs.
Let's see whether it's true or not. Let's start from drugs. Once I've been in the hospital in the US and I had to pay $100 for a small pill of antibiotics, and back in Eastern Europe you can buy like a pack for $5. But that was in a hospital. In actual pharmacy the prices were not that bad. On CMS.go you can actually download a table of itemized spending of US healthcare over the years. And that's going to be our main source of investigation. The overall spending for prescription drugs in 2017 was $333 billion, which is $1,000 US per capita. Let's compare it to Germany, where drugs prices are fair, and if you go to OECD page, you will get that it's $500 per capita. You know the GDP of US is 33% higher than Germany, so we're gonna adjust it. Therefore, the fair price in US would be $665, meaning that pharmaceutical companies stole $335 per capita. Basically, 1/3 of the cost can be saved. Do you remember the headroom? $3,000. So basically, this is only 11% of the stolen money. Honestly, I've expected much more, but maybe we'll have a better luck with insurance companies. Let's see how healthcare system in the US is being funded. I've made this chart out of CMS.go. So Medicare and Medicaid are government funds and they are 37% in total. And private health insurance is only 34%. Out-of-pocket is something which you have to pay to the doctors and hospital outside of insurance, which is another 10%. And the rest 90% is basically various funds. And most of them are actually government owned. Basically what I'm trying to say that insurance is only $3,400 per capita out of $10,000. But let's see how much we can optimize here. I found a report of health insurance company and it looks like 12% of all money goes to administrative cost and 3% goes to profit. In another article I found a similar number and also the confirmation that the government health fund requires only 3.5% of administrative cost. Basically, 11.5% of insurance cost is being stolen from the people. And it's $391 per capita, which is another 13% of our headroom. To summarize, pharmaceutical and insurance industry are responsible for 24% of stolen money. Well, you're probably going to argue that doctors are doing lots of stupid paperwork to reclaim their money out of insurance company, and after Medicare for all, it's no longer be needed, and that will be a huge saving. I guess it's true, but you still have to make a report for Medicare, but it's going to be one unified set of rules, so yeah, definitely you will do some optimization. Well, how much we're going to save on this? I don't really know, but I don't think it could be more that we would save on insurance, so let's add another 10% of headroom, which will make 37% in total. But where is the rest 63% of stolen money? Anything left there? Doctors, med schools, and loans. The life of a doctor starts with 4-year medical school. The total average cost for it is $200K plus cost of living. According to statistics, your average debt after that school is $180K. And then you have to spend from 3 to 7 years depending on your specialization in residency. And your salary will be only $57K per year. With that kind of income you can live a rather modest lifestyle, and you definitely cannot pay off your debt. So after you lose 6 to 11 years of your life, you finally get your amazing doctor's salary. What is the average salary in the US for the doctor? It's $294K per year. In some specialties the average is actually $600K. Well, you're gonna tell me that as a doctor you have to pay for malpractice insurance, and most of the people think that it's super expensive. In reality, it costs from $6,000 to $30,000 per year depending on your specialty, which is probably okay if your salary is $600K. What is the average salary in Germany? I found this article. It says 7,000 euros after 12 years of experience. 84K euros per year doesn't look that much. Oh, maybe I can find another page. This one. Okay, it says 85K for normal doctors, 115 for senior, and top physicians 278. Alright, let's say that the average salary is 100K euros per year, which is $111K per year. And if you do a GDP adjustment, you will get 147K per year. Basically, in the US, doctors are getting twice as much as they should. Can you imagine that? Twice as much! Well, you can argue that they have to pay for the medical school and this malpractice insurance, but not as much. Now you know the real reason why the medical system in the US is so expensive. Although pharmaceutical and insurance industries are evil, but they are just a tiny fraction compared to how evil the doctors are with their incomes. I think Bernie Sanders fully understands that, but he is a politician, he cannot openly say, let's halve the doctor's income. It would be a highly unpopular proposal. Therefore, he follows the standard leftist agenda that corporations are evil and humans are not. Anyway, Bernie's proposal would be the first step to save the money, and I fully support it. But you should keep your expectation real. Don't forget to subscribe and share this video so that more people would know about US healthcare system.